Cardiac arrest is stoppage of effective pumping of the heart. It could be due to total absence of electrical activity of the heart asystole or a very fast, irregular, ineffective electrical activity, fibrillation. Cardiac arrest is immediately fatal unless immediate cardiopulmonary resuscitation, CPR, basic life support or BLS, is started. CPR means external compression of the chest to pump blood out of the heart and giving artificial breaths, either mouth to mouth or using a bag and mask. CPR should be soon followed by electrical countershock defibrillation delivered by a device known as defibrillator to correct the abnormal rhythm of the heart which caused the cardiac arrest. Defibrillation is effective only in certain types of abnormal heart rhythms called shockable rhythms. If it is not a shockable rhythm, continue CPR till the support arrives. How soon should CPR be started? CPR should be started as soon as possible. The time window for successful CPR is very narrow. Irreversible brain damage can occur if blood circulation stops more than 4 minutes, as the brain is very much dependent on oxygen supplied by the blood. Even with CPR, it is difficult to maintain good blood circulation to the brain to sustain it for a long period. Usually, CPR provides only about 1/4 of the normal blood supply. Hence, the time window available to us is about 12 minutes with CPR unless advanced cardiac life support ACLS is available. What is AED? AED is short for Automated External Defibrillator. AED is an electronic device being deployed more and more in public places to treat victims of cardiac arrest. It is also known as public access defibrillation. AED has 2 electrode patches which can be applied to the chest. It will sense the cardiac rhythm and interpret it using a built-in computer algorithm. If a rhythm which can be shocked back to normal, ventricular fibrillation or tachycardia, fast rhythms of the heart, are detected, the device prompts a shock delivery. Everyone should stay clear of the victim when the shock is being delivered. If it is not a shockable rhythm, the device gives audio prompts to continue CPR. What is ROSC? ROSC is the acronym for Return of Spontaneous Circulation. Once ROSC is achieved, further care is known as post-resuscitation care or post-cardiac arrest care. This is aimed at minimizing the brain injury caused by the period of lack of oxygen supply to the brain during cardiac arrest. Compression-only CPR or hands-only CPR. CPR stands for cardiopulmonary resuscitation given for victims of cardiac arrest. It has 2 components: chest compression to replace the pump function of the heart and artificial breaths, mouth to mouth or mouth to nose breaths, or using a device known as ambu bag. Ambu bags, though available with rescue teams, is not available to lay rescuer on the spot. Hence, many potential lay rescuers may hesitate to start CPR, being afraid of transmission of infection from an unknown victim. This hesitation can be avoided by compression-only CPR. Compression-only CPR is usually meant for lay rescuers, in which chest compressions are provided till an AED, Automated External Defibrillator, is available or emergency medical service arrives on the scene. By providing chest compression, circulation is achieved to give enough blood with oxygen to the brain to maintain its viability for a short period. It has been shown to be much superior to lack of CPR and nearing the efficacy of conventional CPR if the duration needed is short. This is because blood in the heart contains sufficient oxygen at the time of most cardiac arrests in adults. This is not the case in drowning and most cardiac arrests in children, where artificial breathing is needed from the beginning. Efficacy of compression-only CPR performed by lay rescuers in adult victims is comparable to conventional CPR performed by them as per recent studies. In children, conventional CPR is better. But if the lay rescuer is unwilling to perform conventional CPR, chest compression with rescue breaths, they may perform compression-only CPR, as it is definitely better than no CPR. Initiation of any form of CPR is associated with a better prospect of survival for the victim. Public access defibrillation is giving access to lay persons to administer defibrillation for out-of-hospital cardiac arrest immediately using automated external defibrillator. Automated external defibrillator or AED is an electronic device which can give electrical countershock to revive a person in cardiac arrest. When the electrode patches of the device are applied to the chest and the device switched on, it detects the heart rhythm and gives audio prompts for action. If it is a shockable rhythm, it advises a shock and delivers one if activated. Otherwise, it will advise the continuation of cardiopulmonary resuscitation. AEDs are usually deployed in public areas where large number of people are likely to come, like airports, railway stations and malls. Even though cardiac arrest is rare in the healthy general public who move around in these areas, the large number of people moving in and out makes the probability of a cardiac arrest fair. Where are the AED patches applied? One patch is applied just below the right collarbone above the right nipple. Second patch is applied on the left side of chest below the breast area. This ensures that heart comes in the electrical path of the shock to be delivered. If there is a pacemaker or an implanted defibrillator, that area should be avoided while placing the patch. In such situations and in infants, one patch can be placed over the front of the chest and another on the back. Giving a shock over an implanted device can cause serious damage to the device. Do you need training to use an AED? Instructions to use an AED are generally written down in places where they are stored. But some basic training comes in handy because your actions have to be very prompt to be useful in a dire emergency like cardiac arrest. Training to use an AED is now part of all basic life support courses. BLS courses are widely available and are being taken by people employed in regions where AEDs are deployed, as well as quite a number of general public and volunteers. Can an AED be used when the victim is in water? Using an AED while the victim is in water and with the bystanders in contact with water can cause harm to bystanders as they may get a shock. Move the victim quickly out of water to a dry area before applying the shock. Moreover, a shock may be ineffective if the chest is wet. The shock, instead of going through the heart, can get short-circuited through the water on the surface, especially if it is salty. What to do if an AED does not advise a shock? If an AED does not advise a shock, it means that it is not a shockable rhythm. CPR has to be continued, but AED will check for the rhythm again after 2 minutes and advise shock if there is a shockable rhythm. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you. How does a defibrillator restart the heart in cardiac arrest? Defibrillator is a device which can deliver a controlled high voltage shock which lasts for a very short period. A heart which has stopped, cardiac arrest, could be either in ventricular fibrillation or ventricular asystole. Rarely, it could also be pulseless electrical activity during a cardiac arrest. A defibrillator is useful only in ventricular fibrillation. In ventricular fibrillation, heart stops pumping because of a very rapid and disorganized electrical activity of the heart muscle. Defibrillator delivers a transient direct current shock in the voltage range of 2000 volts using a highly sophisticated equipment. The DC shock abolishes the disorganized electrical activity due to ventricular fibrillation. When the abnormal activity is abolished, the natural pacemaker of the heart, known as the sinus node, has an opportunity to take control of the heart rhythm. If the sinus node is able to take over the control of the heart rhythm, the heart starts beating normally and soon the person regains consciousness. This is possible only if too much time has not elapsed between the cardiac arrest and initiation of cardiopulmonary resuscitation. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.